Hello everyone, it's my honor to be here to share my research. Our team from 70 Magnetic Resonance Translations Medicine Research Center, Southwest Hospital of Army Medical University, China. This research title is Magnetic Resonance Imaging of Peroneal Nerves and Fascicles of the knee using double echo steady-state sequence at 70 Tesla. So, Part 1 Introduction. The peroneal nerve, tibial nerve, and saphenous nerves are the primary peripheral nerves located in the vicinity of the knee joint and are vulnerable to injury. Although 3T MRI has been effective in observing large nerves, it remains inadequate for smaller nerves and fascicles because of its limited spatial resolution. Our preliminary study also reviewed suboptical image quality for visualizing the saphenous nerve, common peroneal nerve, at the fibular neck, as well as smaller branches of the peroneal nerve using PD and DESS sequences at 3T MRI. In contrast, 70 MRI offers a higher SNR and resolution, enabling more precise visualization of unit anatomic structures. This is our preliminary study results. As this figure shown, the peroneal nerve, tibial nerve, and the saphenous nerve visualization are clearly at 70 MR than at 30 MRI, especially in this sequence. So what is this sequence? The DESS sequence incorporates water excitation technology for fat separation and enhances the distinction between fat and other anatomical structures. And this sequence has been used to image peroneal nerves at 3T MRI, and previously studies have demonstrated its utility for visualizing the cervical nerve systems at 70 MRI. However, applying the 3D DESS sequence at 70 for visualizing the knee peroneal nerves remains unexplored. So, this study aims to access the applicability of the 70 DESS sequence for high-resolution imaging for the peroneal nerves and the fascicular structures around the knee. Part 2 Material and Methods. From July 2022 and January 2024, the final analysis included 32 participants, and MR neurograph data were acquired using a 70 scanner equipped with the 28-channel lead coil. The MR particles included an axial PDTC sequence and two 3D DESS sequences with different resolution. Specifically, a sagittal DESS sequence with an isotropical resolution of 0.4 mm for 3D structural evolution, and then were reconstructed to the axial plane, and another axial DESS sequence with a high resolution of 0.7 multiply 0.17 multiply 2 mm to access nerve fascicles. And two radiologists calculated the SNR of nerves and the CNR of nerve to fat, to fascicle, and to muscle. 5 radiologists evaluated the overall image quality, positive of no artifacts, and the nerve segment visualization of axial source image using a 5-point Likert type scale. And the intra-class correlation coefficient calculated the ICCS of SNR and CNR. The facile kappa calculated inter-rater agreements of quantitative measurements. And when we repeated measures ANOVA test, compared the SNR of nerves and the CNR of nerve to fat to fascicle across 3 sequences. And Friedman test compared the SNR of the nerves to muscle and the quantitative measurements across 3 sequences. Part 3 Results. The ICC for the SNR and CNR exceeded 0.8, The interrater agreement for accessing quantitative measurements ranged from 0.6 to 0.8. At this table and figure shown, the SNR and CNR for the tibial nerve and the peroneal nerve were compared across 3 sequences. Regarding the SNR of nervous to fat, this HR sequence was higher than those of the PD and the 3D DESS sequence. Regarding the CNR of nervous to vessels, PD and the 3D DESS and this HR sequence were higher than those of 3D DESS sequence. At this table shown, 3D and DESS HR sequence demonstrated superior image quality than PD, and 3D DESS and DESS HR sequence showed fewer pulsatile flow artifacts than PD. Regarding nerve segment visualization, DESS HR sequence showed superior visualization of the common peroneal nerve, tibial nerve, and the saphenous nerve than PD and the 3D DESS sequences. This figure is a comparison of axial PD, 3D DESS, and DESS HR images at 70 MR in healthy female. Label 1 means peroneal nerve, label 2 means tibial nerve, label 3 means saphenous nerve, and label 4 means lateral superior cuneatus nerve, and label 4 means tibial nerve muscular branches. However, branches of the peroneal nerve were better visualized in 3D DESS sequence than in PD and DESS HR sequences. This figure is a 3D DESS images in the axial, peroneal, and the sagittal planes show that the peroneal nervus is divided into the articular branch, the peroneal nerve, and the superficial peroneal nerve. Part 4 Discussion. Advanced 70 MRI holds pricing for enhanced nerve visualization. However, studies investigating the applicability remain insufficient. This study demonstrated the potential of 70 MR for imaging the peroneal nervus and the fascicular structures around the knee. In our study, these sequence particles were optimized for comparable SNR and CNR scan times to maximize the image quality. The enhanced CNR plays a crucial role in nerve visualization. The DESS HR sequence achieved higher nerve-to-fat contrast radius, likely due to a decrease in the flip angle compared to the 3D DESS sequence, which reduced T1 widening, lowered fat signal brightness, and enhanced nerve signals. The separation of nerves from adjacent vessels is challenging in MR neurograph. In this study, PD and DESS HR images demonstrated higher levels to vessel signal values. Vascular suppression and higher spatial resolution of the PD and DESS HR images at 70 enhanced the distinction between the vessels and the peroneal nerves. Moreover, we found that these images were less affected by pulsatile flow artifacts than PD images. This is likely due to the longer reaction times and stronger phase code gradients in PD sequence. Notably, the DESS sequence provided exceptional detail in visualizing individual nerve fascicles. It is essential for diagnosing subtle neuropathic lesions affecting individual fascicles. Additionally, 3D DESS sequence exciting depicting smaller peroneal nerve branches, such as articular and muscular branches. Visualizing these branches in vivo using 3D DESS sequence at 70 is clinically significant, especially for reducing nerve injury from the knee procedures. This study had several limitations. Firstly, it lacked data on diagnostic performance across various nerve pathologies. Secondly, we did not evaluate the SNR and CNR values for different slices of the peroneal nerves. Third, while the DESS sequence at 70 offers superior nerve visualization, the increased acquisition time limited their clinical feasibility. That's all my presentation. Thank you for your attending.